All right, we're back in the zone, and pediatricians across the country noting that there is a surge in walking pneumonia cases amongst children. U.S. Centers for Disease Control and Prevention warning doctors and parents about mycoplasma, the condition causing young children to have a cough for weeks. Dr. David Shaker of Shaker Medical Group joining us now. Dr. Shaker, listen, we hear about these viruses, about the flu, I mean, all kinds of things that are happening. I wonder why now an uptick in these.
Look, I don't want to follow up a good football segment by a downer. Let's talk about mycoplasma and what walking pneumonia is. I mean, walking pneumonia simply is pneumonia that you can have and walk and function just fine. We'll see it on an x-ray, but the reality is patients have mild and low-grade symptoms. They're usually not that excessive. Unfortunately, this atypical pneumonia that we're seeing now, for whatever reason, is kind of catching on to kids and being a little bit more aggressive, maybe in a moderate severe category. You'll see patients with getting more aggressive cough. It lasts a little bit longer. They'll have sore throats. They will get on and off fevers. The problem becomes when they have a harder time catching their breath, taking deep breaths, maybe walking upstairs. I usually tell families and parents that a simple way to monitor for this, if you know your child's already ill, is to have something like this, a small pulse oximeter. You can attach it to the finger. You can check the oxygen number. So long as the levels stay above 94, 95%, usually you're going to be okay. Child will improve quite well. And then if it starts to trend down, that's an indication that you want to be a little bit more concerned. Reach out to your primary care physician, reach out to the doc. And if it gets lower than that, consider maybe a higher level of care.
Okay, let me ask you about amoxicillin and penicillin. They say they aren't working. The traditional amoxicillin and penicillin aren't working this time around as well. What's going on?
Look, let's not get ahead of that. So again, walking pneumonia is what's called an atypical pneumonia in medicine. So atypical, it's not going to respond to typical antibiotics. You want to use something different. A lot of times azithromycin is something that we'll commonly use. The typical things, the staph, the strep, those are still going to be well responsive.
Okay, cool.
So it's more this walking pneumonia that's atypical. And something that's so atypical, apparently typical, at least this season around, is there a reason? Is it because of resistance to antibiotics as to why we're seeing the uptick, or just kind of the season we're in?
We're not seeing a horrible change in the way the trending of the antibiotics and what's effective, what's not. I think, it's still flu season. Sometimes the flu virus can be a little bit more aggressive in some cases. Sometimes you're getting allergies that are pushing more. Just a preventative topic for kids. I think it's important that kids are still getting flu vaccines. Don't think of the atypicals. Just think of the typicals. They're more common. We're going to see them more regularly. Kids should be getting flu vaccines, and if the kids don't want to, or the families don't want to vaccinate the kids, at the very least, parents shouldn't be bringing home infections. So have the parents get vaccinated. Avoid large crowds at times. Be careful with Halloween. Hand washing is still by far and away much better off than anything else that we have in terms of preventing infections, right? This is one of those things that an ounce of prevention goes a lot further than a pound of treatment. And we want to be cognizant of that for our families.
I imagine this is incredibly contagious. How does one contract it? Is it airborne? Is it just coughing? How does this work?
So you're going to get both. You're going to get airborne. You're going to get coffee. You're going to get this, this action from the kids. So you want to be, be careful with that. And that's why the hand washing is still among the most important things. Please, as families, don't send kids to school if they've got a fever. That little dose of Tylenol in the morning just to bring the fever down, so we can all go to work and and the daycare can take them in. Those are the things that really propagate the infections. We want to avoid that as best we can.
Got it. All right. Some good tips for parents out there, especially as you head out and trick or treat and hang out with other kids. Dr. Shaker, thank you.